they don't have, the foreigners don't have any problems with us, especially the Americans. They don't have any problems with us communicating. With some other foreign nurses, they do have some language barrier, but with Filipinos, we are good. Uh, we are all aware about moral issues regarding health. What is this? Health, euthanasia, and abortion. These issues are still debatable in some nations like the Philippines. Okay, I worked in a hospital before where abortion is legal as long as the fetus is less than 5 months. And there's so many abortion clinics here. Euthanasia, I think it was only Dr. Kaborkian who practiced that. No other, no other Americans or no other person practice euthanasia here. That's a big issue. Euthanasia is a big issue here too. But abortion, there's a lot of clinic that does the abortion and it's legal. It only becomes criminal if the fetus is viable. I think fetus is viable from 6 months and over. Okay. As a Filipino nurse, how do you cope with this kind of moral and ethical dilemma? Okay. When I was working as an IV therapist, I do start IV in the abortion unit. I only put in the heparin lock, but I do not give any medications for the abortion. I refuse to do it because for me it's unethical, and my conscience will bother me if I did it. So they will not pressure you, or they will not force you to things that you don't want to do. If it's moral, or if there's a moral or ethical issues involved, you just have to tell them. They will not force you. Okay, and the last question is, lots of future nurses are looking forward to work abroad for better opportunities. What advice can you give regarding different coping mechanisms in order for the nurse to deliver quality nursing care without jeopardizing cultural beliefs and practices? Coping mechanisms, nurses, they cope right away, especially us. We're flexible, you know. And my advice for those who are looking forward to working here is have some experience first before you come, because some of the facilities here, they do ask you for experience. Unlike before, it's not a problem. They always give you the experience. And there's a lot of different areas where you could be a nurse. You could be a dialysis nurse. You could be an IV therapist, a clinic nurse, wherein you work in a doctor's office. You could be a rehab nurse, or you could be nursing home nurse. Right now, I'm working in a nursing home. I'm the manager of the vent unit. I have 10 residents all in the vent. It's a nice unit. You know, when you're young, you don't want to be in the nursing home. You want to be in the real world, and that is in the hospital. When you get older, just like me, you don't want any more pressures, you go to the nursing home. After a while, you memorize all the medications, you memorize all the procedures. It's like, you know, you can close your eyes and you can still give the care that, you know, the residents needs. It's when you're over 50, and that's me. Work in the nursing home. It's a good place to relax. Thank you. Bye. Tapos na.
Meron po eh.
No.
Oh,
Ay, ito lang.
It's the same.
good job, Ate Evelyn.
What?
Good job. You won the Grammy, Ate Evelyn.